So the first question I want to ask you is very simple, possibly. What is bullying? How do you define bullying?
So it is kind of a complicated answer because so many different forms of bullying exist, but primarily it is repeated, keyword repeated, aggressive behavior towards children, can be towards adults, that designed to assert control over the person that they're bullying. So the idea of controlling your friends or controlling your social presence or your social media presence. So it's a repeated exposure to someone who is aggressive with threats, physical harm, social threats, verbal, comments. But it is a little bit complicated. People are a little bit confused by what really bullying is, because sometimes we confuse that with being mean and being rude. So there is a difference.
Talk a little bit about cyberbullying. Is that something you could touch upon, or?
Yes.
Okay.
Go ahead.
Talk a little bit about cyberbullying. What makes cyberbullying, I guess, different or even the same as just bullying?
Well, cyberbullying is different mainly because there's such an anonymous presence and it's so fast. We think about how many texts we send in a day, and it's, you put a thought in your brain of, oh, I'm going to text so-and-so, and you do it quickly. And it's the same idea with cyberbullying, is you say something on someone's Instagram account or Facebook account or tweet something, and it's out there for everyone to see. And you can't take it back. And then not only is that person seeing it, but then their friends and the friends of that friend. So it's out there for everyone to see. And it's very difficult to defend against because it spreads so fast, just like wildfire.
When it comes to bullying, what were some, I guess, warning signs or things that maybe parents should be looking for if they're concerned that their child is being bullied?
Well, one of the things that is really important to understand, and we've seen this a lot with a lot of the kids that come through, is that it takes sometimes a while for kids to actually admit something's going on. And so there could be warning signs that you're missing, but the big thing is that there's some social isolation. They're pulling back from things that they used to like to do. They may not want to participate in sports. They may not want to go to school on a repeated basis. They may say, oh, I don't feel well, I'm sick. So they're kind of faking an illness. Their appetite could be different. When they come home from school, sometimes we've seen kids that come home from school and mom says, well, we have to feed them so much when they come home from school, and to find out they didn't eat lunch because there was bullying going on in the lunchroom at school. And so they're very hungry, their appetite changes, difficult sleeping, nightmares, insomnia. So those are just a few of the ways that you can kind of pick up on. But those disguise themselves, with different things that are going on in kids' lives. We're all busy, the kids are busy, so you just have to be really, have an open conversation with your kids. Tell me what's going on, is there anything going on at school? That's the key, is just having an open conversation with your children at all times.
What about if you're worried if your child is the bully? Is there any warning sign or anything that maybe a parent can pick up on to stop their child from doing that?
Again, talking with your children about compassion and kindness is so important, especially with the prevalence of cyberbullying and the prevalence of hate and discrimination that continues in our society. But I think to pick up on some of the key aspects of, if my child is a bully, you might see someone who is fighting frequently, getting into fights, who maybe is not taking responsibility for their actions, kind of saying, nope, I didn't do that, it's not my fault, and kind of placing the blame elsewhere, whether that be on their friends, their siblings, or on society at large. I think the other big key is, are they getting in trouble at school? Is there repeated detentions, repeated expulsions, maybe in trouble with the law? Is there drug and alcohol use? A lot of times, some of those things will correlate with being a bully, but again, you have to really just have an open conversation and just not be afraid to confront, what's going on, and talking with your child about the signs or the symptoms that you think they might be displaying.
What can bullying, if a child is bullied, what can that do to their psyche, I guess?
Well, a lot of things. One, and primarily, I think the biggest, and the thing that we really have to highlight is that it really hurts their self-esteem. They feel worthless. They feel like they're alone. You know, they don't feel like anyone understands. Again, we said earlier that a lot of times kids take a long time before they actually say, well, actually this is what's going on, because they're embarrassed or they're ashamed to say, you know, I was being teased or I was being bullied. And so I think that, you know, prolonged bullying can certainly lead to suicide attempts, suicide completions, unfortunately, depression, anxiety, eating disorders. I mean, all of these things are so common among kids who have been bullied for a long period of time. And so it's important as, you know, a society that we, again, open up the conversation of compassion and kindness and what we can do in schools and as mental health agencies to help the kids kind of deal with what's going on in their daily lives.
What do you think about, I mean, what can be done? I mean, what do you, I guess, I don't know what, if you can say it, I mean, how do you help someone who's being bullied, or what do you tell them?
It's easy to sit here and say that it would be easy to say to them, it'll get better. Sometimes it does, and sometimes it doesn't. The biggest, for me, the biggest thing that I work on with the kids that I see who are being bullied is confidence. And giving them the ability to, that when these things are happening at school, giving them the ability and the confidence in themselves to be able to calm themselves if they're having anxiety symptoms, and to have the confidence to walk away and know that it's okay. That's just one person who thinks that. My mom and dad, my friends, my family think that I'm fantastic. The key is working with positive affirmations and just kind of getting them active. Find things that they like to do, you know, whether it be going for a walk or animals, volunteer, get them involved in social events that they can thrive. But building that confidence back, because it's been kind of ripped away from them, is so important.
How, I mean, it doesn't sound like that's an easy job to do.
It's not an easy job, and it takes a team, it takes a village, literally. But you know, through therapy, you know, hopefully the therapist will be able to implement some strategies with not just the child, but also the family, you know, and to do things as a family that can build confidence to get the kid, you know, back into school. Talk with your school administrators for sure. There are many anti-bullying programs that are out there that are really, really positive. So letting the school know first and foremost so that they can step in to the situation and put a stop to it so that the child is not feeling threatened when they do go to school is also very important.
Would you say that, you know, I think that in the past few years we've heard a lot about bullying. Some people feel that maybe it's just the media highlighting it. Some people feel like, no, there's actually more cases of it. I mean, are you guys seeing more cases of kids coming in, or do you feel that there's more cases, or that they're just more willing to say something?
I think that over the course of the last few years, first and foremost, I think bullying has always been around. You know, we've all probably experienced some form at some point. I think over the course of the last few years, it has been more highlighted because it's become more prominent again online, because we've become so, you know, dependent upon technology that it becomes very easy to bully someone over Facebook or Instagram or text message, and again, those things can't go away. So I do think that we personally here, as the intake psychotherapist here, I have seen an increase in kids that are coming in with issues in relation to bullying. You know, we certainly have seen some kids on the unit, on our inpatient units, again, that all deal with bullying, but we have to decipher, is it because of the bullying that they're here, or are there other issues that are going on? But certainly it's been an increase for us.
Do you think that the kids are more willing to talk about it because it has been brought into the light, or do you know what I mean? Do you think that could be?
I think some kids are more willing to talk about it, again, because especially with, you know, celebrities speaking out and, you know, folks in our own community that are, you know, prominent, successful figures that are stepping out and saying it's not okay. And I can't express how, you know, helpful that can be to kids to see someone successful step out and say this is not okay. But I do think that at times it's easier for kids to step out because there's so many different avenues. School, you know, anonymous online, you know, your teacher, your parents, your therapist, you know, there's so many different avenues. But I think the repercussions of stepping out and speaking that this is going on have also increased, because I think that it becomes consequential for the kids who are actually doing the bullying. More consequential now than it used to be.
What are some of the things that you guys offer here, in particular for kids?
We have an outpatient program that we see children 12 to 18 in our outpatient therapy clinic, and we also have psychiatric services for 12 to 18-year-old children. We also do inpatient psychiatric care for kids of the same age, and then we also have a behavioral health assessment team that does quote-unquote crisis evaluations. For instance, if someone were having a terrible day at school, you know, someone can walk in and have an evaluation done here. They can also go to our emergency rooms and have that evaluation done as well. And we would be able to provide them with resources, hook them up with therapy, hook them up with our partial hospitalization program that also provides intensive services. So we have a variety of services that are available. It's just a matter of getting here and making sure that the kid feels safe.
Can they come here at any time that you guys are open? I mean, how do they come to you guys and get help?
They can always walk in the door. You know, our door is open, I believe, 9 to 7, and they can come in with their parent, of course, for an evaluation. They can also, if they're not here for an evaluation for inpatient services, they can always fill out a referral form. We always encourage folks to go through their school counselor. School counselors can refer them. Go to your emergency room as well as your family pediatrician or your family doctor.
I do want to ask, I was thinking about another question, and do you think, like when it comes to bullying and suicide, some people say it kind of goes hand in hand, that it's becoming more and more that that's what kids are turning to. What brings a child, and I don't know in your experience if you can talk about, what brings them to that point to choose that?
You know, I can't speak for the children that certainly have completed that act because I think that we all question why. But I think for the kids that I have talked to and have treated and helped along this path, I think they feel hopeless, and I feel like there's no one that can help them. No matter who I tell, the bully is always going to be there, no matter what I do. And again, we go back to the cyberbullying. It's never going to go away. It's always going to be there. You know, we talk about, I know I talked with the parents so many times about please be cognizant and mindful of your child's presence on any kind of social media because it never goes away. And I think that they hear that so much that it becomes ingrained that they think, well, because so-and-so said this, no one can ever erase that. So that's who I am. And they take that identity on and they feel like there's really no other way to get rid of that identity except to be completely gone.
Anything else? Anything you feel like I didn't touch upon? Give you an opportunity to say. I'm trying to think in my head. Is there anything you think I didn't ask, or?
I don't.
I feel like we covered a pretty wide range, yeah.
Yeah. I think it's important to just note quickly, you know, there's so many different forms of bullying. You know, there's the online bullying, there's the verbal abuse, you know, sexual harassment, threats to not be your friend any longer, or to tear your books up from school, you know, and these are repeated things that happen on a daily basis, but there's so many different forms, you know, the verbal, the social, the online, and then of course we all know about the physical bullying, you know, the kicking, spitting, hitting, but I think we need to keep in mind that there's so many different forms, and just because one is not the super prevalent one, that it's not happening. And I think it's just important to remember that we have to believe the kids when they come to us, because sometimes we're their only line of defense.
You kind of got another question going. Some people think that kids are just weak, you know what I mean? Because, you know, bullying's been around. Kids are just weak, they don't want to, you know, they're too sensitive. That's not too sensitive, not weak. What do you say to that?
Well, it kind of goes back to the point earlier in regards to there's bullying and then there's mean and rude. And I think that we have to look at all three of those things and realize that bullying is repeated exposure to these aggressive acts. Somebody who's mean and somebody who's rude, you know, it may happen one time and we can brush it off and just go on. But someone who's repeatedly coming in and pushing the kid up against the locker, smacking his books to the ground, taking his lunch, you know, and then tripping him on the way out of the building at the end of the day. These are repeated acts that degrade this child to the point where they feel like they have no other options. So being sensitive, being weak, maybe, but I don't think so. I think that it's just a matter of, again, standing up and saying, this is what's happening. And I think you're right, because kids then think, well, gosh, am I weak? Am I sensitive? You know, because I'm sure my mom and dad dealt with this, you know, but again, cyberbullying and this online presence is so much bigger than I think ever before, and we certainly didn't have that, thank goodness, when we were in school, and I'm sure their moms and dads didn't either. So it's a completely different ball game for these kids now.